अस्सलाम वालेकुम। कोरोना वायरस सिम्टम्स, कॉजेज़, डायग्नोसिस एंड ट्रीटमेंट। कोविड-19। आज हमने कोरोना वायरस के बारे में पढ़ना है। कोरोना वायरस कोविड-19, दिस इज़ अ न्यू रेस्पिरेटरी डिजीज़ which is highly contagious and it is mainly spread from person to person. COVID-19 virus spreads primarily through droplets of saliva or discharge from nose when an infected person cough or sneezes. So it is important that you also practice respiratory etiquette. How is coronavirus COVID-19 spread? Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can lead in the mouth or nose of the people who are nearby or possibly inhaled into lungs. Through close contact with COVID-19 infected person, approximately within 2 meters or 6 feet or 2 to 3 steps. This can be through hugging, kissing, and handshaking, standing close by touching objects and surfaces contaminated by coronavirus, and the touching the mouth, nose, or eyes. These are the transmission method of coronavirus from person to person. Now we will study the symptoms or alamat, जिसको हम अलामतें कहते हैं. Fever, chills, and repeated shaking with chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting. Risk factor of COVID-19: hypertension, diabetes mellitus, pregnancy, age, asthma, renal diseases, alcoholism, smoking, cerebrovascular diseases. These are the risk factor of COVID-19. COVID-19 diagnosis process: call your healthcare professional. Second is the exam and throat swab. Third is, if needed, the other labs and testing will be done. If your symptom match COVID-19, you may also ask to isolate at home. COVID-19 diagnostic strategies: antibodies against SARS-CoV-2, SARS-CoV-2 genome molecular test, SARS-CoV-2 structural protein or whole virus. These antigen test. 3 types of strategies. Do you have a fever? Yes. Are you experiencing shortness of breath? If yes, you have COVID-19. If no, you may have flu. Do you have itchy eyes? If yes, you may have allergies. If no, you may also have common cold. These are the different strategies. These showing difference between COVID-19, flu, allergy, and common cold. This is the pathogenesis. COVID-19 effect on the lungs, then lungs edema, pulmonary edema, dyspnea, acute respiratory distress, acute lung injury, COVID-19 effect on alveoli, then type 2 pneumocyte cells and cytokine storm. Potential complication of COVID-19. First is the cardiac, MI, heart failure, myocarditis, arrhythmia, respiratory, ARDS, pneumonia, dyspnea, hematologic, PE, DVT, DIC, thrombocytopenia, neurologic, cerebrovascular disorder, meningitis, encephalitis, systemic, acute liver injury, acute kidney injury, cytokine secondary infection, septic shock, miscellaneous, vascular, vasculitis, encephalitis, cutaneous erythema, and vascular lesions, and it is showing the other cutaneous lesions. These are the potential complication of COVID-19. कोरोना वायरस में जो complication आती है ये दिखाई जा रही है. इसके अलावा हमने आगे देखना है COVID-19 vaccine. How you are COVID pregnant, you have your COVID-19 vaccines. It's important to have both doses of your COVID-19 vaccine to protect you and your unborn baby. COVID-19 infection is currently circulating and can be serious. Combination prevention for COVID-19: stop the spread of COVID-19, physical distancing, mask in public, PPE for high risk occupation, limit public gathering, vaccines, school, venue and non-essential business closures, stay home when sick, clean hands and surfaces, prompt testing and isolation, contact tracing, avoid touching face, caring for COVID-19 symptoms at home, hand washing, use fever reducing medicine, rest, drink plenty of fluid, social distancing, clean and disinfect surfaces. People who are moderately and severely immunocompromised should be prioritized for an additional dose of COVID-19 vaccine after 1 to 3 months. People with compromised immune system don't always develop sufficient immunity against COVID-19. The truth about COVID-19 vaccine trigger the body natural immunity to respond the virus so that it can fight real infection. This is showing the COVID-19 vaccine reducing the virus. Your second dose of the COVID-19 vaccine, first is the AstraZeneca, second is Moderna or Pfizer. Body is building immunity after 2 weeks, then it is called fully vaccinated.